everybody. Thank you so much for joining us tonight on this live. We want to really apologize for being behind schedule. This is due to some technical issues that will be on our control. Thank you so much for staying put and for joining us today as we will be discussing sexual dysfunction, and this has come mostly due to the questions that we've received from you guys, amazing viewers, amazing followers of the Intimate Matters podcast. This is the Intimate Matters podcast. Your go-to podcast when it comes to things that pertain to sexual and reproductive health. We believe that your intimacy matters, and this is why we're here to discuss it. We bring in other health professionals to discuss your intimate matters as it pertains to your sexual and reproductive health. And we also, answer your questions. We give you opportunity to ask anonymous questions where we can answer and provide you with the right feedback so that you can use this to make informed decision. So we're going straight into the discussion. So we want to talk about sexual dysfunction, right? There's been a whole lot of misconception about sexual dysfunction, from the fact that it affects only some set of people, and some people say that it's only when people can have dysfunction even when they're not having sex, actually. Right. In fact, as a matter of fact, there are certain forms of dysfunction that can result in you not even wanting to have sex. That's a possibility, a very big possibility. So for this evening, the way we're going to look at it, we're going to look at what is dysfunction, as the case may be. It's important that we establish what dysfunction is, and then from there we're going to move to different forms of dysfunction, what could be possible causes or risk factors, and then we are going to look at how you can seek treatment and care, as the case may be. All right, so when we talk about sexual dysfunction, we're looking at a variety of problems that can occur at any phase of the sexual response. So is it the time you're looking for a way to have desire? Is it when you are trying to get aroused? Is it when you are having orgasm or the peak of sexual pleasure? Or is it when you are done having sex and you want to go back to normal? Sexual dysfunction can occur across all those. It can occur when you're trying to have the desire. So for example, if you're having problems with desire at the extremes, I don't even feel like having sex, or I always feel like having sex all the time. That's a dysfunction. It could be an issue with arousal. I cannot be aroused. No matter what you do, I can't be aroused. I'm always aroused all the time. I'm aroused, but anytime I want to penetrate, I cannot penetrate. All of those things. Then it can be an issue with orgasm, right? I never attain pleasure. I don't even know what is pleasure. I'm never ejaculated and all this. That's a dysfunction. It can also have issues with resolution. I don't do and finish. I don't knock finish. Why can't I go back to normal, right? Those are the kind of issues that we're talking about when it comes to sexual dysfunction. All right, so moving right on, let's start with the first one, the desire disorders. The desire disorders comes from the both extreme. When you do not have interest, there's lack of interest at all. So, like I said, sexual interest, right? Sexual desire, it's a normal desire that everybody should have. If you do not have, something is wrong somewhere. The sexual desire is a desire that everybody should actually have this desire. But if you do not have this desire, then something is wrong. So people that have lack of sexual interest, especially prolonged, we could understand when you have lack of interest at a certain point in time, things happen. But then when you do not have interest in sex for whatever reason, you don't feel the desire, then something is wrong. So what could be wrong? We're going to look into it as we move forward. Then, as we're talking about what could be wrong, it could be hormonal imbalances. So, for example, the major hormone responsible for men's sexual desire is testosterone. For female, it's estrogen, progesterone. If you do not have these, if there are imbalances in these hormones, you may have issues. It could be stress, physical stress, psychological stress. mental stress, as the case may be. All of these things could be a very big problem, actually. Then we're also looking at depression. Let me just put it into like some psychological disorders, depression most especially. Now, which could come from, depression personally, or it could also be, as a product of relationship depression. So it could be due to personal circumstances, or it could also be due to, relationship. You're not feeling the vibe in the relationship. That could also be a problem. Then, like I mentioned, relationship issues as a whole. I'm not attracted to my partner. I don't like my partner. My partner is not treating me fine. He or she is not preparing my body before preparing my mind. All of those things come together to become a big problem when it comes to desire disorders. Then we have arousal disorder, which is the difficulty becoming physically aroused. Example is erectile dysfunction in men, right? So erectile dysfunction has to be that you do not have, or even when you have an erection, it is not strong enough or it is not sustained. So it is like it has three parts, right? Which has to be that you need to have this erection when you want it. It should be strong enough and you should be able to maintain it, right? So that is what we have to do with sexual, but that's how it has to do with arousal disorder. Just give me just a minute. Let me share the link with people who have been waiting. I've got a couple of messages from people who are asking about joining the live, so I need to share the link with them. All right, so while I'm waiting to share the link with them, let's go forward. So we have orgasm disorders, right? Which is delayed, absence, or premature. Premature ejaculation is a form of orgasm disorder, right? Premature ejaculation, World Health Organization definition, if you ejaculate before 2 minutes as a man. So people who have premature ejaculation or who have anorgasmia, they think that you cannot attain orgasm, mostly affecting women, right? So you should enjoy sex. You should get to the peak of sexual pleasure, whether you are a man or you are a woman. If you realize that consistently you do not get there, then something is wrong. So this one comes in so many factors. It could be psychological factor, you're not stimulated enough. It could be physical factors like underlying disease condition, problems with the blood vessels, right? It could be neurological factors, the problem with the nerves. This often these often are issues. Problems with the nerves are issues because the nerves control, the sensation as the case may be. So that also is a very great problem. Then it could also be issues with drugs. Some medication may impede your sexual pleasure, right? So it's essential that you know that some medication can impede your sexual pleasure. So you need to be very careful of the kind of medication that you use so that it doesn't become a problem to you or a problem to your partner as the case may be. Then we have pain disorders, pain during intercourse. Example is dyspareunia, vaginismus in women, or pyrrhonic disease. So vaginismus in women has to be that the vagina does not relax enough for easy penetration, right? So it's like an excessively tightened vagina hole, which is a problem because it doesn't allow penetration. Then for pyrrhonic disease has to be that there is an erection, but that erection becomes sustained that it leads to pain to the men. So such has become a problem. All right, so that is for pain disorder. So what could be the cause of this? We could have infections, hormonal changes. We could have issues with blood vessels. For example, pyrrhonic disease. The blood vessels is clogged and the blood cannot return as that when it should return. So the erection becomes suspended. Sometimes abuse of drugs, abuse of sexual enhancers leads to this, right? And this become a problem. This become a big problem to the person that took this drug. So hormonal changes can also cause this. So generally, the common causes of dysfunction could be physical. The common causes of dysfunction could be physical and could also be psychological. Just 1 minute. Let me share this live. All right. Okay. So sorry about that. I had to share that to people who are trying to join. Share the link. So the physical causes could be underlying conditions, health conditions like diabetes. So diabetes affects your blood vessels, so it could become a problem. It could also affect your nerves. Then heart diseases, then hormonal imbalance, right? So if you have low testosterone, it can affect your sexual function as a man. If you have low estrogen, it can affect your sexual function as a woman. We also have neurological disorders like multiple sclerosis, Parkinson's disease, anything that affects your nerves. Don't forget that your nerves is essential for you to feel sensation. So anything that affects your nerve can actually be a problem to you enjoying sex. Then medications, I've talked about it, antidepressants, some cancer drugs, some blood pressure drugs can affect your sexual function. Like I said, for men, your erection is due to the function of your cardiovascular system. So if you're taking anything that affects your cardiovascular system, for example, blood pressure or medications, it can directly or indirectly impact on your sexual function. Then we have substance abuse, which could range from alcohol, could range from tobacco or other substances, hard substances. All these things pile up in your body and then they become a problem. For psychological causes, we have stress, anxiety, and depression, right? So if you're having stress, anxiety, and depression, it could also be a problem as to how you respond to sex. That could be a big problem for you. And we have past trauma, especially sexual abuse. Now, if which I know you're an ardent follower, if you look at our last episode when we were taking anonymous question, a lady asked the question about why she cannot enjoy sex. Now, if for people like that, if you have, especially your first experience or you've had a bad experience in terms of trauma, maybe you are looking at assault or looking at, coercion, manipulation, whatever it is, people like that tend to have a very wrong mindset about sex and they're less likely to enjoy sex, right? So they may grow up with dysfunction. Either they have sex aversion, which you do not want to hear anything about sex, or they become very much addicted to it. So trauma is a very important psychological cause. That's why it's essential that if there's somebody that has gone through trauma, we advise the person to seek help. Seek help and go through the right process. Seek help, get the right help so that you can be put through the right process as it could be. It's very, very essential. Now, it might not even be trauma related to sex. It could be personal trauma, post-traumatic stress disorder, right? We're talking about you have a personal trauma, maybe trauma from family, maybe you've had so much trauma that you have lower self-esteem. Somebody told you will never be enough. So you've taken you've never been enough from the context of your physical life and you've pushed it into your sexual life. that you never feel enough for your patient or for your client. Sorry, you don't feel as if you could ever be satisfied or somebody can ever satisfy you. Now, another thing that affects sexual function, there are physical things like FGM. By FGM, I mean female genital mutilation. We're coming up with an episode about harmful sexual practices, where you hear about certain things that we do that are harmful to us, either health wise or in terms of enjoying sex as a whole, right? So that is how it is with FGM and so many other things. So many other things. Then we have relationship conflict. Something people overlook. If your relationship is not okay, you will not enjoy sex, right? That's why in the earlier I talked about preparing the mind before you prepare the body. So you are abusing your spouse or your partner, and you think they will not enjoy it. You're in a place where you have a lower self-esteem, people are abusing you, whether physically, whether sexually, whether emotionally. You will never be able to enjoy sex. You won't. So that's the issue with relationship and conflict, right? Sometimes if you feel guilt, maybe you are with the wrong person, you are with somebody you're not supposed to be with, you may feel guilt and you'll not be able to enjoy all these things. So any kind of relationship conflict can come in and become an impediment to you actually enjoying the whole sexual process. Okay, so let's look at some common treatment option. Now, it's important to note that treatment option is dependent on the actual cause, right? There's no one size fits all. So let's say, depends on what you're having. If it's erectile dysfunction, for example, there may be drugs, there may be psychological therapy, depends on what causes it, because we have the physiological cause of erectile dysfunction, for example, and the psychogenic cause, right? It's very, very essential. So there could be drugs, there could be psychotherapy, as the case may be. Then we have hormonal therapy. Either we're doing testosterone or estrogen replacement, which is very important. Those are the two important hormones: testosterone for men, estrogen for women. So there is need for that hormonal replacement therapy. Then there is the pain management. If you have a condition that has to do with pain, like vaginismus, as the case may be. So now this is where it's important that you should know the cause of. You should go to the hospital and get yourself assessed to know what is actually the cause of the problem you're having. You don't just assume and start to take anything. So we have psychological therapies like cognitive behavioral therapy, sex therapy, couples counseling. It's essential. So if your problem has been found to be caused by psychological problems, you need to go through this process. Very, very essential for you to go through this process so that you will be so that you'll be able to, right, you'll be able to get the right care, get the right treatment. It's very, very much essential for you to do that. All right, then you may need lifestyle changes, like you may need to exercise more, you may need to eat healthy, reduce your alcohol intake, and some other substances that may not be beneficial to you. It's quite important that you do that. Very, very important that you do that. Right? So some people do not know that what they consume, you are what you consume. So you are eating food that are predisposing you, you're taking substances that are predisposing you to dysfunctions. That itself becomes a very big problem if you're taking something that predisposes you to dysfunction. So it's essential also for you to know this and take something that is quite okay for you. All right, so another thing that you could also do would be stress management. Stress can be a cause of this problem. Stress can be a very big problem. So anything can stress you. We have physical stressors, psychological stressors, environmental stressors, so many things. So you need to ensure that, you're not stressed. Some people don't know how stress play in. That's why sometimes if your partner is like, no, I don't want to do it, you should respect them because at that point that they're stressed, they may not enjoy it. So when you're seeking help when it comes to dysfunction, you may need to visit different people depending on the problem you have. You may need to visit gynecologists. This is mainly for women. urologists for men and also for women, and maybe therapists. So the first two is for people that are having physiological problems. If your problem is due to a physical condition, but if it's psychological, go and see a therapist. It's quite essential that you go and see a therapist. A therapist will help you. A therapist will, put you through everything that you actually need to know so that you can actually make the right decisions and make the right choices. It's important. It's very, very much important. And a whole lot of people are coming down with dysfunctions and they do not know that it's dysfunctions. So please, if you realize that you're not enjoying sex, everybody should enjoy sex. Yes. If you hate sex, something is wrong. Like I said in the last episode, if you hate sex, something is wrong. You shouldn't hate sex. So make sure that if you have any dysfunction, if you think that something is wrong, you're not enjoying sex, either you're having issues when it comes to desire, either you're having issues when it comes to arousal, when it comes to orgasm or, the sexual pleasure, it's all resolution. Every time you finish having sex, you're in pain. Every time you finish having sex, you're feeling this cramping. Those are dysfunctions. So please go and get help. So today we're here to talk about sexual dysfunctions. We look at it from the definition, look at the ones that has to do with the physiological aspect and the psychological aspect, basically. That is what we've been looking at throughout today. Then we talk about possible causes. We're looking at the physical causes. We're also looking at the psychological causes, as the case may be. And then we also look at possible treatment options. Possible treatment options. So that is what we brought in, for people to learn and to know about sexual dysfunction. So if you have any questions, if there's anything you want us to, discuss as pertaining to sexual dysfunction, please do well to ask. Do well to put it in the comment section. So I'm currently checking if there are any questions. Oh, sorry, somebody was asking if there's no caption. We don't have caption. So I'm currently checking if there are any questions, as the case may be. If there are any questions, please do well to drop it in the chat. Please do have any question as it pertains to sexual dysfunction, if possibly even any other thing that pertains to sexual and reproductive health. We'll be glad to, let's learn together. Let's interact. Do we have any question? Still looking at the comment section if we have any question. I don't seem to see any question. Do we have any question? All right. So if we do not have any question, if we don't have any question, if there are anything you would want us to discuss on, because we'll be doing this live webinar on a monthly basis, if there anything you would want us to discuss, please do well to reach out and you can drop in the comment section. Maybe for our next monthly webinar, we could discuss. We'll be glad to discuss that. Thank you so much, everyone that have shown up. I've seen Yesi, I've seen Quest to Know, I've seen Ifwama Chime. Thank you so much for joining us on this session. We're very glad to have you. Thank you, Temple, for joining. Very glad to have you. And we hope that next month we can come around and we can learn again. Do not forget, to share these videos and all of our other videos to your friends, your families, your loved ones, and your relatives. Don't forget to follow us on all our social media platforms. On Facebook, subscribe to us here on YouTube. Follow us also on TikTok. We have sessions there on TikTok, live sessions on TikTok. And then join our personal WhatsApp channel. We'll be glad to really have you. Thank you so much, everyone. Thank you, everyone who has joined this conversation today. And I hope that you found value on this conversation. And until we will come your way next time, we say we're very much grateful. I'm Nosakwa Okwan, the host of the Intimate Matters podcast, and we believe that your intimacy matters. Thank you so much, and goodbye for now.